My name is Josie Montegaard. I'm a nurse practitioner at Dana Farber Cancer Institute in Boston, Massachusetts. And I support two CLL physicians. So I see pretty much CLL all day, every day, which is really great because CLL is so dynamic in how it presents, how people go through their treatment, and the updates in the field. You know, what we were treating patients with a couple years ago is different than what we're doing now, and will be even different than what we're doing in a year from now. So, even though it is sort of um, a one type of cancer that I see all the time, it is ever evolving and makes it really interesting. I think when I think about things that are important to know when when an APP is seeing CLL patients, the biggest thing that I can think of is first and foremost when to treat CLL patients. CLL is unique in that it's an indolent lymphoma. So patients get diagnosed and often are asymptomatic from their disease in the beginning. So they don't require any treatment up front, and they're observed for a period of time until they meet a criteria for treatment of CLL. So it's really important to know when a patient does meet that criteria, because there have been studies that show that patients um, do not benefit in overall survival from early treatment of their CLL. But obviously, when you introduce treatment to those patients, it introduces side effects. So if they're not gaining any benefit from the treatment and you're just exposing them to side effects earlier on, that could be a detriment to the patient. Additionally, while we have all these really great CLL treatments, we do have patients that have aggressive disease features or are getting diagnosed really young and bypassing those treatments. They're going through them, eventually progressing, and then needing additional therapy. So we're still working on identifying what those third, fourth, fifth, etc. lines of treatment will be. But until we get those solidified, that can be a challenging population to treat. So the more we can sort of kick the can down the road in delaying treatment until it's really appropriate, the better it is for the patient. So that's a really important thing right off the bat that a nurse practitioner should know. Additionally, because nurse practitioners are so heavily involved in seeing the patients, often seeing them more often than the physician, we really need to understand what the side effect profiles of the treatments are and how to manage them. And what are the tricks of the trade that sometimes aren't always always elaborated in the clinical trial data, but that we find is helpful in managing these side effects. I'm really passionate about looking at that because these patients sometimes are on these treatments for years of time, years and years. And if they're having a nagging side effect day in and day out, that really can affect their quality of life, even if it's not a life-threatening side effect. So, sharing the tricks of the trade, what works, what doesn't amongst the APP community is really helpful, and just understanding what you and your patient should be looking out for when the patients are on these medications. And then lastly, I think uh, moving on to when a patient is progressing on treatment, it's really important to understand what type of testing you should be doing at various stages of the treatments in order to determine when maybe you should start a new line of treatment and what treatment that should be. Because we are fortunate that we have a lot of really great testing to help identify new mutations in our CLL patients or genetic abnormalities that may make us choose one treatment over another. So it's important to know what those tests are and when to perform them in order to recommend the best treatment choice for your patient.